What if going to bed too late or not sleeping enough was quietly lowering your chances of getting pregnant? We talk a lot about diet, exercise, supplements for fertility, but what about sleep? And that's a conversation that's just getting started. In both men and women, I'm going to break down the research of what it actually shows about sleep deprivation and fertility outcomes. Hi, I'm Tina Constantino. I'm a naturopathic doctor with over 20 years of experience working in both a clinical and hospital setting, and I've helped thousands of women achieve their health goals. So I do want to start off with a little bit of a disclaimer. The overall evidence and the multiple lines of evidence of sleep show that it does actually affect fertility, but most of the data is what we call observational and not definitive. But I think that we all can agree that getting better sleep is always a good idea for multiple reasons. Roughly 80%, 78% to be exact, of sleep studies show that sleep does affect fertility, and only 11% show that possibly affects fertility, and another 11% of studies show that it's a mixed bag. The evidence is leaning towards that sleep does affect fertility. Let's look at women and what the studies show. For women, we all know that sleep affects us. Let's just find out by how much. Large review studies looking at patients, thousands of patients, show that poor quality of sleep and extreme sleep durations, meaning less than 7 hours of nightly sleep, or very long sleep durations over 9 to 10 hours of sleep, are linked with worse fertility outcomes. A 2025 analysis of IVF patients found that women with better sleep quality had modestly higher pregnancy rates. The studies actually suggested roughly 15 to 25% higher odds of clinical pregnancy compared to those women with poor sleep. And the 2024 systematic review reported that women with poor sleep were repeatedly found to have fewer mature oocytes retrieved and matured oocytes, which are your eggs, lower fertilization rates, and lower clinical pregnancy rates and lower live birth rates. In some IVF cohorts, poor sleep was actually associated with about 20 to 30% lower clinical pregnancy rate compared to women reporting good sleep. And it's not just insomnia. Research shows that later bedtimes, irregular sleep schedules, like if you're on a shift worker schedule, also affect outcomes. These seem to be detrimental. Women sleeping over 10 hours a night had significantly fewer retrieved oocytes, mature oocytes, and fewer high-quality embryos. Conversely, while some studies found that short sleep, less than 7 hours, reduced a quantity, others noted it might slightly increase retrieval rates but potentially lower overall quality. So we see this with shift work style patterns, difficulty falling asleep, frequent trouble falling asleep more than 3 times a week, is associated with a significant reduction in blastocyst formation. And all of the above are associated with longer time to pregnancy and higher risk for infertility. So it's not just how long you sleep, it's also how regular your sleep cycle is. The relationship between sleep and fertility is primarily mediated by a circadian clock rhythm and hormonal pathways. Sleep disruption interferes with these rhythms, leading to abnormal hormonal fluctuations that impair generation of follicles and your ovulation. Now, you also have adjustments to your melatonin and oxidative stress, which occurs. Melatonin, which is synchronized by the sleep-wake cycle, is crucial for egg maturation and protects the eggs from oxidative damage. It's one of the strongest antioxidants your body actually has. Large population studies have shown that women diagnosed with sleep disorders have approximately 2 times the odds of infertility. And this is even after adjusting for BMI and other confounding factors. Later bed-wake times and irregular sleep behavior relate to higher infertility risks and longer time to pregnancy. And there is a bi-directional nature to this problem. While poor sleep impairs fertility, the psychological stress of infertility and the physical discomfort of fertility treatments can, in turn, degrade your sleep quality. It is a vicious circle. So if you suspect or know that you are a poor sleeper, please head out to your primary caregiver who is qualified and a certified health professional. Not a sleep coach off of Instagram, because finding the cause of your sleep difficulties and treating them matters for your overall health, not just for fertility. Now let's talk a little bit about the men. Large systematic reviews and meta-analysis have found that sleep disorders are associated with significant reductions in total sperm count, sperm concentration, motility, normal morphology, the whole shebang. Some pooled data show reductions in total sperm count and concentration in the range of 10 to 30% lower in men with poor sleep compared to those with normal sleep. A recent cohort of 727 infertile men found that poor sleep quality, measured through the Pittsburgh Sleep Quality Index, was associated not only with worse semen parameters, but with markedly lower partner pregnancy probability. In that study, men with poor sleep had a roughly 4 to 5 times higher likelihood of not achieving pregnancy when sleep quality was poor versus good. So for men, both semen quality and actual partner pregnancy outcomes appear to be significantly worse with poor sleep. So the bottom line, across both men and women, the evidence consistently suggests that poor or dysregulated sleep is associated with 20 to 30% lower IVF pregnancy rates, a twofold higher odds of infertility in women with sleep disorders, 10 to 30% poorer semen parameters in men with poor sleep, and lower fertilization and live birth rates in ART cycles. The effect size is modest. Sleep isn't the only factor, but it is a meaningful factor. And unlike age or genetics, sleep is something that we can actually change. So if you're trying to conceive, improving sleep quality and regularity may be one of the most simplest and overlooked things that you can actually do to help yourself. It's a modifiable lifestyle factor in fertility health. Speaking of modifiable factors, the next topic of discussion is going to be an awesome breakfast to start your day, packed with micronutrients to optimize fertility. And if you'd like to see that, take a look at this link. Thank you for watching. I hope you found it helpful. Please like and subscribe because it does help me create more educational videos.